Since November this year, over 1,400 medical internees have been on an industrial strike in demand for their unpaid enhanced allowances, as promised by the President. Although they have addressed their concerns to the relevant authorities, especially Minister of Health, nothing much has been done to address their concerns. In the recent letter dated 10th December 2021 from the Director Health Services, Dr. Henry Gimwebesa, he ordered all medical internees to vacate their respective places of work following the expiry of their internship term. It's against this backdrop that Center for Health and Human Rights Development (CEHAT), Uganda Medical Association (UMA), and Federation for Uganda Medical Internees (FOMI) filed a suit in courts of law. The suit is filed against the Attorney General, the Director Health Services, Dr. Henry Gimwebesa, and Minister of Health.
The right to the industrial action is constitutional. The labor laws allow employees to lay down their tools for them to negotiate for better working conditions. But unfortunately, instead of their demands being met, the same government seems to be insensitive or aloof to their conditions, and instead now asks them to vacate their training institutions, to vacate the hospitals where they are doing training from, such that they fail to complete their course.
Kenneth Sebabi, counsel representing the petitioners, highlights on some of the petitioners' prayers in this suit.
For orders compelling them to recall the directive that in essence asks them to vacate their training centers, to implement the directive of His Excellency the President that is meant to enhance their wages from 750 to 2.5. So we have filed the miscellaneous cause for administrative orders. We have also filed an application for an interim order restraining the Minister of Health and Attorney General from enforcing the directive of Mr. Mwebesa that in essence seeks them to vacate the hospital premises.
Dr. Ledo Samuel Odong, President Uganda Medical Association UMA, expressed their disgrace on Dr. Mwebesa's letter to medical internees.
So even when we have been in our instruction, we've been lenient enough to have engagements with government. So a Director General to come up with such a letter, when he knew the team that is in instruction is purely having dialogue and discussions with the government, was watering down the efforts that we had put in to address these issues.
Although this issue was meant to be tabled in Parliament today, however, the Speaker of Parliament, Jacob Olanya, has decided to extend the matter come the next Parliament sitting next week. According to the letter that was released by the Permanent Secretary to the Minister of Health, Dr. Diana Atwine, on 15th December 2021, medical internees' concerns are said to have been addressed to the Minister of Finance. According to the State Minister Planning and Finance, Henry Musasizi, while addressing legislators on the floor of Parliament, confirmed that his ministry has already processed these people's salary on the Minister of Health's account.
That is what our clients want. So let our clients be settled. They will again give us instructions to withdraw the case. It is their case, they can withdraw it, but can also maintain it until their demands have been met by government.
Deborah Namamonde, Nantongo Rebecca, UBC News.